My name's Maddie, and I'm going to be presenting on apixaban. Our patient is an 82-year-old white female presenting with recurrent atrial fibrillation. She reported random episodes with palpitations, weakness, dizziness, and rapid irregular pulse rate that were not triggered by any activity in particular and sometimes occurred at rest. These episodes could last anywhere from 2 hours to 4 days and resulted in decreased levels of consciousness that altered her decision-making capability. She was prescribed a number of drugs, such as dofetilide, to acutely control these episodes, but developed tolerance to many of them, so had to continue to change her prescription regimen. She also underwent a number of cardioverts in an attempt to return to normal rate and rhythm. After receiving a subtherapeutic effect from all of these, she underwent an ablation, which was therapeutic for 3 months, but then she reverted back to atrial fibrillation. Ultimately, she underwent pacemaker surgery, and that, in combination with apixaban sold under brand name Eliquis, has created a therapeutic effect. The patient's current drug regimen outside of apixaban includes Protonix, Fosamax, Lasix, metoprolol, and simvastatin. Apixaban is an anticoagulant which works by targeting factor XA and inhibiting it, therefore decreasing thrombin and clot formation. Factor XA is the activated form of protein X, the coagulation factor, and is the central factor of the coagulation cascade. Factor X is an enzyme which plays an important role in multiple steps of the coagulation process, so by inhibiting factor X, the coagulation process is halted. When inhibited, factor XA keeps prothrombin 2 from binding to it and becoming thrombin, which is the factor in blood that causes the actual clotting of blood, via converting fibrinogen to fibrin, aka the actual clot. This drug specifically works to prevent embolism in atrial fibrillation patients because in atrial fibrillation, the heart slips into a state of panic, so to say. When the heart is in this chaotic state, it is not effectively pumping blood out of the atria and into the ventricles, and this results in turbulent blood flow within the atria. This turbulent blood flow creates a stagnant effect and leaves the blood more susceptible to clotting since it's stuck in one place for a prolonged time and isn't properly circulating around the body as it should. While this drug effectively prohibits clotting factors, which is beneficial in some respect, it also means that the patient needs to be careful in their day-to-day life, as they are more susceptible to bleeding should they encounter it. They will take much longer to stop bleeding and should be cautious and aware of this. This drug was chosen over other anticoagulants because it doesn't affect as many clotting factors and your bleeding and clotting time is not as labile. So therefore, when you're on apixaban, you don't have to have as frequent labs, and therefore it was more conducive for her lifestyle. She experienced no adverse effects and her labs have not shown a decreased clotting time.